Strong legs are the foundation of senior mobility, balance, and independence. After age 60, muscle loss accelerates, especially in the lower body, making everyday tasks like standing up, climbing stairs, or walking more difficult. Without proper leg strength, even minor falls can lead to serious injuries such as hip fractures, which often require long recovery times and may reduce a senior's ability to live independently. That's why it's not just about exercise. It's about protecting freedom, confidence, and quality of life. Many seniors experience leg weakness due to long hours of sitting, lack of muscle use, or poor circulation. Fortunately, the right daily leg exercises can help maintain and even regain strength. These exercises aren't complicated or time-consuming, and they don't require any fancy gym equipment. Done properly and consistently, they can significantly improve leg muscle tone, joint support, and blood flow. They also help relieve leg pain, reduce the chances of leg cramps, and support better posture. Whether you're 60 or 85, building stronger legs starts with a few simple routines performed daily. In this video, we'll walk you through 5 essential leg exercises every senior should do each day. You'll learn how to do them safely, how many repetitions are ideal, what time of day is best for each, and how to adjust them for your own comfort level. These are exercises you can do right in your living room or bedroom, using just your body weight or a sturdy chair. If you're over 60 and want to stay on your feet, avoid falls, and move without fear, then keep watching. These 5 leg strengthening moves can change everything. And the best part? They're easy, natural, and proven to work. Seated leg raises are one of the safest and most effective ways for seniors to strengthen their thigh muscles without risking balance or joint strain. All you need is a sturdy chair with a straight back and no wheels. Sit upright with your feet flat on the floor, knees at a 90-degree angle. Rest your hands on the sides of the chair for support. Slowly extend your right leg straight out in front of you, holding it parallel to the floor for 5 seconds. Then lower it back down with control. Repeat the same with your left leg. Aim for 10 repetitions per leg, once in the morning and once in the evening. If you're just starting, even 5 reps can help build endurance over time. This exercise works the quadriceps, the large muscles at the front of the thighs, which are essential for walking, standing up, and climbing stairs. Strengthening these muscles can significantly reduce the strain on your knees and help prevent falls. Don't rush the movement. A slow, steady pace allows muscles to engage fully and protects your joints. If your legs tremble slightly at the top, that's normal. It means your muscles are working. For added challenge as you grow stronger, you can wear light ankle weights, but this is optional. Always breathe normally and avoid holding your breath during any part of the movement. Seated leg raises are especially helpful for those with arthritis, limited mobility, or balance concerns because they eliminate the risk of falling. Done consistently, this simple exercise improves strength, boosts circulation, and helps seniors regain confidence in their mobility. Make it part of your daily routine. You can even do it while watching TV or after breakfast. Strong legs start with small, consistent habits like this. Standing calf raises target the muscles at the back of your lower legs, which are crucial for walking, balance, and preventing foot pain. These muscles help propel you forward with each step and support your ankles and knees. To perform this exercise safely, stand behind a sturdy chair or countertop, placing both hands lightly on the surface for support. Keep your feet hip-width apart and flat on the floor. Slowly rise onto the balls of your feet, lifting your heels as high as you can. Pause at the top for 2 seconds, then gently lower your heels back down to the floor. Repeat this movement 10 to 15 times. As your strength improves, you can work up to 2 or 3 sets per day. This simple motion strengthens the calves, improves ankle stability, and encourages better blood flow to the lower legs, which is especially important for seniors dealing with circulation issues or swelling. If you experience leg cramps or fatigue after walking, this exercise can make a big difference over time. It's also helpful for anyone who has trouble standing up after sitting for long periods. Make sure to stand tall and keep your back straight throughout the movement. Avoid leaning forward or locking your knees. For added benefit, try performing this exercise in the morning to wake up your legs and again in the evening to ease stiffness from the day. Always wear supportive shoes if needed and avoid slippery floors. With consistency, standing calf raises can strengthen your step, improve your walking ability, and make your legs feel lighter and more energized. If you want stronger, more stable legs after 60, this daily movement is essential. It only takes a minute, but the benefits will last a lifetime. The sit-to-stand exercise is one of the most functional and powerful movements seniors can do daily. It mimics a basic activity everyone does, getting up from a chair, and strengthens multiple muscle groups at once, including the thighs, hips, and glutes. This movement also reinforces balance and coordination, helping prevent falls and building independence. Start by sitting upright in a sturdy chair with your feet flat on the floor and shoulder width apart. Keep your hands crossed over your chest or lightly resting on the armrests if needed for support. Lean slightly forward from your hips, press through your heels, and slowly rise to a full standing position. Pause briefly at the top, then lower yourself back down with control. Avoid plopping into the chair. Go slowly to build muscle and joint control. Aim for 10 repetitions, twice daily. If you find it difficult at first, place a firm cushion on the seat to make it easier, or use your hands to help guide yourself up. As you get stronger, try doing it without arm support to further challenge your legs and balance. This exercise is especially valuable for seniors who want to stay active and avoid needing assistance with basic daily movements. It boosts leg strength, improves core stability, and supports a healthy posture. Over time, it can reduce the strain on your knees and hips while making it easier to move around your home, get up from the toilet, or rise from a bed. This isn't just an exercise. It's a practical strength builder for real life. Do it after breakfast or during a TV commercial break. It takes less than 5 minutes, but pays off in freedom, safety, and self-confidence. Keep practicing daily. It's one of the best habits for aging well. Side leg raises are excellent for strengthening the muscles on the outer thighs and hips, particularly the gluteus medius, which plays a vital role in stabilizing your hips and improving balance. This is especially important for seniors because strong hips help prevent side falls, the type most likely to cause serious injury. To begin, stand beside a sturdy chair or countertop, using one hand for support. Keep your feet together, your posture tall, and your gaze forward. Slowly lift your outside leg straight out to the side without bending the knee or leaning your upper body. Lift as high as is comfortable. Hold for a second or two, then gently lower your leg back down. Repeat this motion 10 times on each leg, alternating sides. As you build strength, increase to 2 sets per day. If standing is difficult, this exercise can also be done lying on your side on a firm bed or mat, lifting the upper leg instead. Always move slowly and with control to avoid strain or injury. Keep your toes pointed forward and avoid rotating your hips. The goal is to target the outer thigh and hip muscles directly. This exercise not only boosts leg strength, but also supports better walking stability and reduces pressure on the knees. If you use a walker or cane, stronger hips will help you feel steadier and more secure. Side leg raises are quick, easy, and can be done in just a few minutes. Consider doing them as part of your morning or evening routine, such as right before brushing your teeth or after making your bed. With consistent practice, this small movement becomes a powerful tool in preserving mobility and protecting against falls. Strong hips mean greater independence. And it starts with this daily habit. Toe and heel walks are simple yet powerful exercises that target the muscles in your feet, ankles, and lower legs. which are often overlooked but essential for balance, walking, and fall prevention. This exercise not only strengthens your stabilizing muscles, but also helps improve coordination and proprioception, your body's ability to sense its position and movement. To begin, stand tall near a hallway wall or countertop for support. For toe walks, lift your heels off the ground and walk forward slowly on the balls of your feet for about 10 steps. Then, stop, rest, and reverse the movement for heel walks. For heel walks, lift your toes off the ground and walk forward with your weight on your heels for another 10 steps. Keep your steps short and controlled and avoid leaning backward or forward. If needed, perform the walks in place by alternating feet while holding on to a sturdy surface. This exercise is excellent for building strength in your calves, ankles, and the front of your lower legs, which helps prevent conditions like foot drop and leg fatigue. It also encourages better circulation, which is critical for seniors with diabetes or peripheral artery disease. If your balance is limited, start with a few steps each day and gradually build up. Toe and heel walks are best done in the mornings to wake up your legs or in the evening to stretch out tight muscles. Always wear supportive shoes or non-slip socks to avoid slipping. Done consistently, this small movement can greatly reduce your risk of tripping, improve your gait, and make walking feel more secure. Remember, stronger feet and ankles mean better stability. And these walks are your first step towards safer, more confident mobility. Knowing when and how to perform these 5 exercises can make a big difference in both safety and results. For seniors, the best time to do leg strengthening exercises is either in the morning to activate the muscles for the day, or in the early evening to relieve stiffness and promote circulation. Choose a time when you feel most alert and energized. Avoid exercising right after meals or when you're overly tired. Always begin with a few gentle ankle rolls or light marching in place to warm up your joints and muscles. A warm-up takes only 2 minutes but prepares your body and reduces the risk of injury. Perform each exercise slowly and with control, focusing on proper posture. Keep a sturdy chair, walker, or countertop nearby for support to avoid balance-related issues. If any movement causes sharp pain, stop immediately and consult your doctor. Mild soreness is normal when starting, but pain is not. Stay hydrated before and after exercising, and wear comfortable, non-restrictive clothing. It's also smart to wear rubber-soled, non-slip shoes for better stability. Start with 1 set of each exercise per day, and gradually work up to 2 or even 3 sets as your strength improves. Don't rush progress. Consistency is more important than intensity. If you use assistive devices, check with a physical therapist on how to modify these exercises for your needs. Keep a small calendar or checklist to track your progress, which can be motivating and help establish the habit. Even just 10 minutes a day can lead to noticeable improvements in leg strength, stability, and energy. The goal is not perfection, it's progress. These simple routines, done daily and safely, are your building blocks to stronger legs and greater freedom. Even with the best intentions, seniors often make small mistakes during leg exercises that can reduce effectiveness or increase the risk of injury. One of the most common errors is moving too quickly. Rushing through repetitions may feel easier, but it doesn't give your muscles time to engage fully. And it increases your chances of losing balance. Each movement should be slow, steady, and deliberate. Another frequent mistake is poor posture. Slouching while sitting or leaning forward too much while standing can strain your back and knees. Always sit or stand upright, keeping your spine neutral and shoulders relaxed. Avoid locking your knees when doing standing exercises. A slight bend protects the joints and maintains control. Skipping a warm-up is another major issue. Cold muscles are more prone to stiffness and injury, so take 2 minutes before starting to gently loosen your ankles, knees, and hips. Some seniors also perform exercises without support, thinking it will make them stronger. But until your balance improves, using a chair, wall, or countertop is essential for safety. Overexertion is another concern. Doing too many repetitions too soon can lead to joint pain or fatigue. Start small and increase gradually. More isn't always better. Better is better. Lastly, inconsistency limits results. Doing exercises just once or twice a week won't create lasting changes. The key is to make them a daily habit, even if it's just one set per day to begin with. Track your progress, listen to your body, and celebrate small wins. These mistakes are easy to avoid with mindfulness and patience. Safe, effective leg strengthening isn't about doing things perfectly. It's about doing them regularly, correctly, and with care. That's how you build strength that supports your independence. You don't need a gym membership or fancy equipment to strengthen your legs. But a few simple tools at home can make your daily routine easier, safer, and more effective. The most important tool is a sturdy chair without wheels and with a firm back, which provides reliable support for seated or standing exercises. A non-slip exercise mat is another great addition, especially if you're exercising on tile or hardwood floors, as it helps prevent slipping and adds cushioning for comfort. Resistance bands are excellent for seniors looking to gently increase strength without lifting heavy weights. They come in different tension levels, and even the lightest ones can offer great benefits for leg exercises. You can loop them around your ankles for added resistance during seated leg raises, or use them while lying down to stretch and tone your thighs. Light ankle weights, starting as low as 1 pound, are another helpful option once your muscles have adjusted to body weight movements. These are especially useful for seated or side leg raises, but should only be used after consulting a healthcare provider. A step stool can also be used for step-ups, a gentle way to build leg strength and improve coordination, but it must have a non-slip surface and be placed on stable flooring. Finally, keep a small bottle of water nearby to stay hydrated and a towel to wipe away sweat. Setting up a small, dedicated corner for daily exercise can make the habit feel more intentional and motivating. You don't need to spend a lot. Just make sure your space is well lit, clutter-free, and safe. With a few basic items and the right mindset, your living room can become a powerful space for building stronger, healthier legs every single day. Building stronger legs after 60 doesn't require hours of hard work. Just a clear plan and a few minutes each day. Here's a simple, effective routine you can follow starting today. Begin with a 2-minute warm-up. Roll your ankles, gently march in place, and take a few deep breaths to loosen your joints. Then, move into the 5 key exercises in the following order. Start with seated leg raises, 10 reps per leg. Next, standing calf raises, 10 to 15 reps. Move on to sit to stand from a chair, 10 full repetitions. Then do side leg raises, 10 per leg. Finally, walk 10 steps on your toes, and then 10 on your heels with support. This whole routine can be completed in about 10 to 15 minutes. If you're just starting, begin with 1 set per day and increase gradually as you feel stronger. The best times to do these exercises are in the morning to wake up your legs, or in the early evening to stretch them out after a day of sitting or light activity. Stay consistent. Doing a little each day is far better than pushing too hard once or twice a week. Use a checklist or calendar to track your efforts and stay motivated. Always listen to your body. Mild fatigue is normal, but pain is not. If needed, rest between exercises or use support to stay steady. With time, these small efforts will lead to noticeable changes, improved balance, reduced leg pain, better posture, and greater confidence with every step. These 5 exercises are your daily insurance against weakness, stiffness, and injury. Stick with this plan, and in just a few weeks, you'll feel the difference every time you stand, walk, or move. Strong legs mean strong living, and it starts with today.